So bone grafting, what procedures do you use a bone graft?
Yeah, for dental implants, a lot of times, what we're looking at is if somebody's been missing a tooth for a long time, the bone collapsed, it eroded away. So sometimes we have to rebuild that. And we're looking at bone that's maybe a little too narrow. Or we're looking in the sinus, and I know it's a scary thing. Everybody says sinus. I mean, so many people have sinus problems, so that really elicits a response from people when you say sinus. But it's a very straightforward procedure. But sometimes where that dental implant has to go to replace a back tooth up top, there's not adequate bone to support that implant, and we know to make it healthy long term. So the procedures are all very straightforward. We don't, the other thing too is I don't take bone from another place. Sometimes, there's other places in the mouth and the jaw where there'll be a second surgical site. Okay. So you have to have a whole other surgery, same day, but you have to have another area. You're taking bone out. There's some other risks that go with that. We don't have to worry about that. We're able to use tissue bank tissue, which is very safe stuff. Use it all the time.
Just like shoot it into the area?
Well, you can sometimes, yeah. They actually do, some of them make them a syringe, but it's in like a particulate form. You just rehydrate it with some sterile water. A lot of times, actually, my preferred method is to do a blood draw for the patient. I can take your own growth factors, I have a centrifuge, take your own growth factors, I can concentrate those growth factors, and then combine that with the tissue bank bone, and that has phenomenal healing. The healing's amazing. I remember the first time I looked at one of those after I did, the very first one I did, I was shocked at how good the bone healed. Heals faster, heals better, lower inflammation.
So bone grafting is not something to be afraid about?
Absolutely not. Absolutely not. They're safe, they're predictable procedures, and the side effects are very little. There's
How soon can they eat? I mean, are they sore the next day?
Yeah, we have to be honest. There's going to be a little bit of discomfort from that. So softer foods for a few days, but after that, everything's fine. You're able to start eating and chewing like normal.